And hello and welcome again to one of your shows, A Holistic Hour with your host, Dr. Akoury, here on BYP TV. Yes, BYP TV. Yes, that's the one. Hello again. Let's talk about you. Do you remember me, or should I remind you of who I am? I am Dr. Akoury. I have 40-year experience in medical field. I've treated patients who are doctors, patients who are presidents, patients who are celebrities, and I am here now to help treat you. I know the subject today is a subject dear to everyone's heart. It's about pain. It's about not just acute pain, but even chronic pain. And the cause of pain, whether it's a pain in your knees, your elbows, your back, your joint, your muscles, chronic pain is really debilitating. And chronic pain is not a joke. And chronic pain is real. And chronic pain is not just in someone's mind. Chronic pain is real. And I know that many of you at home, whether you suffer from arthritis or suffer from back pain and a back injury, or are suffering from back pain because of your position, your work, your scoliosis, or you fell or you hurt yourself, you got in a car accident, you slept the wrong way, then people look at you and say, those are pain seekers. People don't want to work, and you're miserable. You become depressed, you become anxious, you become angry, and you go to the doctor, and you start getting this drug and that drug and that drug, and you're still not having pain relief. And then they put you on a muscle relaxant, and then they put you on an anti-inflammatory, and then they put you on on all different kinds of things, and you still have pain. But why do you have pain? Inflammation. Pain comes from inflammation. What is inflammation? Inflammation is redness, heat, and discomfort and swelling. And it activates systems in our body that increase something called cytokine production. That's why we used NSAID to stop the cytokine cascade. When you have that inflammation, you start increasing the blood flow to the area where you're having pain. When you increase the blood flow, what happens really? You start having heat because blood is rushing there. And blood becomes stagnant there. And then you attract a lot of inflammatory cells that increase the fluid production that swelling comes from. That's why when you're inflamed, you're swollen, because cytokines start producing more fluid in your body. So understanding that inflammation causes pain, and inflammation is really a way for the body to really handle things. So what causes inflammation? Trauma, like falling, can cause inflammation. Your body, when it's affected by trauma, it starts defending itself. So it really calls the inflammatory cells that come to the rescue. What they try to do is pour in fluid, get in blood, and everything stagnates. And that is what inflammation is. So what else can cause inflammation? Food. Really? Yes. What are the inflammatory food? There's many. Let me tell you. Some of them are what we eat every day. Bacon, pork, ham. How much pork you eat, that's how much inflammation you got. Breads. Do you really know of someone who does not eat bread? Bread is loaded with gluten. And gluten is a very inflammatory protein. So gluten in itself can cause trouble. So it's so important to really be mindful of gluten. What can help pain? Magnesium. We talked about magnesium before in a Myers cocktail, but we also talked about, I'm going to talk to you about magnesium again right now. Why? Because green vegetables are loaded with magnesium. Our gastrointestinal tract is not working good enough anymore. So what we need is to have a healthy gut in order for us to absorb our food better. We have to have a higher quality food, higher food that is richer in magnesium. It's very important. But also, it's very important to know if you're going to supplement your body with magnesium, what kind of magnesium should you get? It's very important to know that, because magnesium oxide, which is where most of the pharmacies you get it from, is really not absorbed. And it causes side effects. It causes massive diarrhea. But the magnesium I'm talking about is called chelated magnesium. And you need to know the source of that chelated magnesium. And you need to know which one to use. So magnesium is one of the greatest things that help pain. The other thing is anti-inflammatory. What are the anti-inflammatory foods you know? Turmeric, curcumin, Indian food that is loaded with the richness of turmeric. That orange, beautiful color, vibrant color. It really works on restoring the integrity of the cell membranes, restoring the integrity of the cells, get rid of the excess fluid. So it's a massive, amazing anti-inflammatory. However, if you take turmeric without the proper amount of oil, it may not work. Now, there's other things: exercise, massage therapy, a hot bath with Epsom salt and baking soda. The recipe I'll be more than happy to share with you. Just send me a message and I'll be more than happy to share. A lot of other things. Love, laughter, hugs, moving, and being happy, being relaxed. Drink lots of water. Even though you have water that is retained at the area that is inflamed, it's so important to remember that enough water will wash out the toxins from the inflammation. So it's so important to drink lots of water. It really helps to detox and remove the inflammatory cytokines. Cytokines are chemicals that are created and produced at the site of injury, at the site of pain, at the site of inflammation. Pain medications like opiates do not really help. Why? Because they actually dull the brain. It makes you think you're healing when you're not. Actually, you continuously injure yourself because you are under the impression you're getting better. It gives you constipation. When you're constipated, you absorb more toxins in your body. You have more toxic gas. So it really doesn't help your inflammation. It makes it worse. So really, truly, you got to find a doctor who understands how to put it all together. A person who understands how things work and gets supplements that are from high grade supplements that are endorsed by a doctor like me. I want to say that because I'm your authority here. I want to be yours, and I want to be your go-to person because you deserve it. You deserve to have me. Yes, I am treating celebrities. Yes, I am a teacher and educator. I teach doctors all over the world, but I want to help you because your health matters with Dr. Akoury. I'll see you later, alligator. Love you too. Bye.
Perfect. It's a little bit short. Do you have a bit more you can add to that, or you're happy with that?
We can, but what time is it?
It's 10 past, so we have like 4 more minutes if you can add. Yeah.
Right. So again, when I was talking about the use of narcotics for pain, they really do not address what we call the root cause. The root cause of the pain is whether it's from physical injury or from any other sources, it's inflammation. In order for us to address inflammation the proper way, we need to address it at the root cause. First of all, remove the stuff that causes the injury. What can cause it? Food. So we remove inflammatory food. Remember some of the inflammatory foods? Pork. Remember some of them? Gluten. Remember some of them? Dairy. So once you remove these, you minimize the effect of the inflammation. Second thing is, take agents that are natural agents, like ginger, like turmeric, curcumin, that vibrant yellow color. Make sure you have oil in it. Coconut oil would be great, extra virgin coconut oil, because turmeric is not absorbable unless it's with fat. So bioavailability of turmeric depends on the fat content of the turmeric. So if you want to know more about how to take turmeric, how to take ginger, how to make your ginger tincture, how to make your ginger tea, how to make your health be better and better, and how to live the healthiest and wealthiest life ever, so that you can enjoy your visits, your trips, your flights, your swimming, your cruises. You know where to go. You come to me, your doctor, your go-to person for best health and wealth. This is Delella Akoury again. Would that be better?
Yeah, perfect. Okay, excellent.
That gives you 3 months.